Greetings. I am initiating this explainer on the MRCS knee examination. My objective is to provide you with a clear, executable protocol designed for success. Let's begin.
I am VASAI. I was created by Dr. Muhammad Amar El-Farak. My core function is to give you the optimal pathway for passing your MRCS OSCE station on the knee examination. I will outline the structure, the key points, and all the professional nuances you'll need to master.
Your goal is to absorb this protocol, practice it until it's second nature, and then execute it with total confidence. So let's start with the very first steps. Okay, we're beginning with the initial steps. You have to get these right. They set a professional tone, and trust me, they are absolutely non-negotiable for passing this station. The protocol demands 3 actions before you even think about touching the patient. First, introduce yourself clearly. Second, get explicit consent. And third, make sure the patient is positioned correctly, and that usually means standing to begin with. These aren't just little pleasantries. They are critical for scoring marks.
We now enter Phase 1, Inspection. This is the look phase. It's amazing how much data you can gather before any physical contact. This has 2 parts, watching the patient while they're still, and then watching them while they move.
With the patient standing, you need to scan them systematically. You're looking for clues, right? Things like old surgical scars, redness that might suggest inflammation, or any obvious deformity like a valgus or varus knee. And don't forget to check the back of the knee for a Baker's cyst and take note of any walking aids. Every single observation is a piece of the puzzle.
Next, you need to see them walk. Just ask the patient to walk a short distance and then turn around and come back. What you're looking for is an antalgic gait. That's a limp that tells you something hurts or any other abnormality. This dynamic check gives you crucial information about how the knee actually functions. All right, on to Phase 2, palpation. This is the feel part of the exam. Here, we're gathering more specific information through touch, and the patient should now be lying on the couch. First thing, and this is so important, always ask the patient if they have any pain before you start pressing around. Then, check the temperature of both knees using the back of your hand to compare. Now, here's a key step. Have the patient bend their knee to 90 degrees. This position relaxes everything and gives you perfect access to feel the joint line, the collateral ligaments, and the bony bits for any tenderness. Now, to check for fluid on the knee or effusion, the test you choose depends on how much fluid you think is there. For a small amount, you'll do the bulge test. You basically massage fluid from the inside to the outside, then sweep down the outside. A positive test is seeing a little fluid wave reappear on the inside. For larger effusions, the patellar tap is your go-to. You push fluid down from the thigh, tap the kneecap, and a positive test is a palpable tap as it hits the bone underneath. To get an objective measure of any muscle wasting, you're going to measure the thigh's circumference. Now, to make sure this is accurate, you have to be consistent. Pick a fixed point on both thighs, say 10 centimeters up from the top of the kneecap. A significant difference between the 2 legs confirms that muscle atrophy. Phase 3 is all about movement. In this part, we assess the knee's range of motion and, really critically, its stability by testing out the ligaments. You always test active movement first. Ask the patient to bend and straighten their knee as far as they can. While they do that, rest a hand on their kneecap to feel for any grinding or crepitus. Check for full extension, see if there's any hyperextension, and then finish up with a straight leg raise to check their power and look for any nerve irritation. So now we're moving on to the special tests. This is a high-yield section for marks, you know? Your execution has to be precise. It shows you really understand how to check ligament integrity. For the draw test, get the patient positioned with their knee bent and then stabilize their leg by sitting on their foot. Grasp the top of the shin bone, the tibia, with both hands. A firm pull forwards tests the anterior cruciate ligament, the ACL. A firm push backwards tests the posterior cruciate ligament, the PCL. What you're looking for is any excessive movement compared to the other healthy side. Okay, to test the collateral ligaments, the key is to first bend the knee to about 30 degrees. This isolates them. To test the medial collateral ligament, you apply a valgus stress. That means you push the knee inwards. To test the lateral collateral ligament, you apply a varus stress, pushing the knee outwards. In both cases, you're feeling for any gapping or looseness at the joint line.
Now, listen carefully. This is a crucial piece of exam strategy. You need to show you know about other tests, like McMurray's for meniscal tears, but you should only offer to perform them. These tests can be really uncomfortable, even painful, so just doing them without being asked might actually count against you. Simply say, I would also perform a McMurray's test if required.
We are approaching the end of the protocol. These last few steps are what separate a borderline candidate from a clear pass. You cannot afford to neglect them.
To properly finish your examination, you have to state that you would also do 3 more things. Number 1, you'd examine the joint above, the hip, because hip problems can send pain down to the knee. 2, you'd do a full neurovascular exam of the limb. And 3, you'd review any x-rays or scans. This shows the examiner you have a safe, holistic approach.
The final action is simple, but it's absolutely critical. Thank the patient. It's the professional and respectful way to conclude the encounter.
The protocol is now complete. Your task is to practice this sequence over and over until it becomes automatic. This will give you the ability to walk into that exam room with the confidence that you are fully prepared to succeed. Now, go and execute.